afternoon, everybody. I'm Ellen McKenzie. I'm chair of the Department of Health Policy and Management here at the School of Public Health. I would like to welcome you on behalf of Dean Clagg, who unfortunately couldn't be with us here today, but on his behalf and on the behalf of the School of Public Health and the Department of Health Policy and Management, I welcome you here so that we can together remember and celebrate the life of Barbara Starfield. To many of us, if not all of us in the room, Barbara was a true colleague, a friend, a mentor, and she was also someone whose work has and will continue to have a significant influence on how we think about health and healthcare delivery in this country and around the world. I first got to know Barbara when I was a young assistant professor, and I'll date myself. This was back in the late 1970s. And at that time, Barbara was head of the Division of Health Policy in now the Department of Health Policy and Management, so this was my first faculty appointment. And you can imagine how lucky I felt to have Barbara Starfield as a mentor and as a role model as a young woman. She was doing it all. Not only was she internationally recognized in health services research and a leader both within and outside the school, but as importantly for me at that point in time, she was a wife and a mother of 4 children, and now 8 grandchildren? 8 grandchildren. She amazed me then, and she continues to amaze me. As I was reading through all the remembrances that have been posted to the website at the school, it's just amazing what she accomplished in her lifetime. I have since come to understand that having a spouse who is a full partner in marriage and family, and one who avidly supports and encourages your career, makes a huge difference. And Barbara had that in spades in Tony Holtzman as a husband. Tony, I'm so very pleased that you're here with us today as we remember Barbara and celebrate her life. And I should add that Barbara and Tony, as a Hopkins couple, paved the way for many of us, including myself and my husband, Jim Tilsch. And to this day, I remind my colleagues who have a spouse working at Hopkins and are getting ready to send their children to college that it was Barbara and Tony who really fought for equal educational benefits for children of married couples who worked at Hopkins. Today, you will hear from many colleagues and mentees of Barbara, but they can only begin to capture what Barbara really meant to the world. I encourage you again to go to the department's website and read the hundreds of testimonies from colleagues around the world, from Europe, from Latin America, Australia, Korea, Taiwan, and many other parts of the world. And it will remind you of the far-reaching influence Barbara had and how deeply she was revered and how deeply she was loved by many people. Now, I thought of sharing several of these with you and decided to limit it to just one. From Dr. Cho on behalf of the Korean Academy of Family Medicine. And he wrote, "Dr. Starfield was someone that really lived every day to the fullest. Her commitment and energy to make a better and fairer world for everyone strikingly inspired. She taught us what family medicine doctors should and could do by showing her own act of dedication. She was a wonderful mentor, a great intellect, and an incredible inspirer who will be greatly missed. We want to say that her spirit has touched many lives. We will devotionally cherish what she has left us, her dedication to equality in healthcare." Now, in thinking in the department and in the school how best to pay tribute to Barbara to ensure her legacy in the department, in the school, and for the field of health services research in general, the decision was pretty easy when we thought about it. Given her many years as a mentor to several people, many of which you'll hear from today, it was very clear to us that we should establish and endow a Barbara Starfield Scholarship Fund. This endowed scholarship will support doctoral students at the school who focus their studies in health services research and health policy, and who are interested in the organization, delivery, and outcomes of primary care, and in understanding the impact of equity on health. And we look forward to awarding the first scholarship in the next academic year. In her last editorial published in a journal, one of the journals she founded, the International Journal for Equity in Health, Barbara reiterated the themes to which she dedicated her life's work that include equity in health and health care, a whole person view of morbidity and disease, and the central role that primary care must play in assuring a more effective, more efficient, safer, and more equitable health system. She wrote in this editorial, "A whole patient-oriented view of disease is more accurate than a disease-centered view. It is also more equitable. Diseases are more likely to occur and to be more serious in socially disadvantaged people. Only a person-focused, rather than a disease-focused, view of morbidity in which multiple illnesses interact in myriad ways can accurately depict the much greater impact of illness among socially disadvantaged people and the nature of the interventions that are required to adequately manage the increased vulnerability to and interactions among diseases." She concluded the editorial by calling on primary care physicians to take leadership in moving medical care where it needs to be, to the care of patients and populations and not the care of diseases. Barbara will continue to inspire us and keep us on the right track with this editorial and the incredible volume of the work she leaves behind. She will be missed by many people and in many ways. I would now like to introduce Dr. Jonathan Weiner, who's Professor of Health Policy and Management at the school. Many of you know Jonathan quite well, as he was a very close colleague and friend of Barbara's for over 30 years. He was also had the privilege of being one of Barbara's mentees or doctoral advisees. Jonathan, I think, has a very challenging task in front of him because we've asked him to summarize the many dimensions of Barbara's professional legacy. And what did we give you, about 10 minutes, Jonathan?
Something like that.
Good luck with that. Jonathan.
Thank you, Ellen, and thank all of you for coming. Also, we are recording this, and so there'll be people watching this live all over the world. Barbara would have liked that, since her colleagues were, in fact, all over the world. In fact, 10 minutes is quite a challenge. I'm first on deck, and we had thought about a whole symposium today, but we thought that would be too much. So instead, we're actually going to have a symposium later in the spring that focuses on her legacy, which was great. So we're here today to celebrate the life and the legacy, and the legacy is tremendous, of our colleague and friend Barbara. And I thank you for coming and viewing from, I think we've had people today from 4,000, 5,000, 6,000 miles away, and we know that even more will be viewing us from those locations. Barbara was multifaceted. I'm going to try in 10 minutes to give you a flavor of some of those facets. I know that my colleagues that follow in their remembrances, and then the open mic that we'll have toward the end will share even more of the many sparkles of the diamond that was our colleague Barbara, many carats. There have been several family remembrances, so we're going to focus on Barbara's professional life, but of course Barbara the person, it'll be a lot more than just her professional life. And we will talk about and help you. I've studied her CV. I've studied her 350 articles. She's left quite a legacy for the world. We'll talk mainly about the fact that her entire career, although she traveled often, at last count, I counted 40 countries in the last 2 years that she spent. I don't know about you, but Tony's nodding. Something on that order in terms of just what was on her CV, 40 countries. But I will give you an overview, and then others will give you the personal remembrances. So Barbara, I think, had several dimensions professionally. She was a nurturing mentor, and some of you know that she didn't have a retirement party because she didn't retire, but we had a celebration of mentorship. I counted on her CV 29 doctoral students. I was number 4, and I was lucky. She had about 25 postdoctoral fellows, and I count probably about 50 junior faculty around the world that she took under her wings. So that was a really important piece. But in addition to mentoring, boy, was she a path-breaking visionary scientist. And I'll give you a flavor of that, and I'm sure you'll hear from the colleagues about some of the areas that she touched. And there are many. I know colleagues that worked with her for years not knowing about other areas of her work. That's how much of a Renaissance woman she was in many ways. And in my 35 years here at Hopkins, shall we say I've met a few smart people and a few that are a bit driven and a few with a mission to accomplish something. I mean, here at the Public Health School, we have to have a mission. It's tough to be at a public health school without that. But nobody came close to Barbara in terms of, the drive for doing good. And she had a fire in her belly. It wasn't much of a belly, you know, she's pretty slim, she was, very diminutive, but any of you that were ever on the other side of that desire to change understands of what a change agent she was. But what really drove her was she didn't like injustice, she didn't like inadequacies, she didn't like inequities. And I'm afraid our life, our system is full of many of those things. But first she started out, and again studying her CV, I knew her from 1977, you know, on till her death in June. But even before that, I think first it was East Baltimore, then it was the U.S., and then it was the world. So let's talk a little bit about the fights that she took, the inequities that she wanted to right. First, the cause was the child in the adult's world, and we'll hear a little bit about her pediatric background. From there, it was the primary care physician in the specialist world. And some people have called her the quote, not my quote, this is on our wall. And if you haven't, you should all Google Barbara Starfield memory wall, and you'll see unbelievable emotions and stories about Barbara. But someone called her the high priestess of primary care. So she was perhaps the best known, it's been a while since she provided primary care, but perhaps the best known primary care physician in the world, arguably. The cause of public health in a tertiary academic world. Everybody asks me, Jonathan, you guys at Johns Hopkins, you don't have family medicine there, do you? Well, no, we're one of the 4 in the country, or 3 in the country that doesn't. Well, how come you're one of the best known groups of primary care studies? Well, again, that goes back to Barbara and in the circle that she brought around her, which many you'll hear. And then throughout her career, but particularly the last 5 or 10 years, she took up the fight of the have-nots versus the haves. And we know that that is a fight that will go on for some time. And again, the founding of the Journal about Equity in Health. So how did she do all this? You know, again, a very diminutive, soft-spoken. She acknowledged during the special mentorship event that she actually was shy. I never knew her as shy, but I think early on she might have been. Certainly not in the last 50 years that I knew. But what was her approach? It was very methodological, straightforward, and I think we all have a lesson to learn. Those of us that had the privilege of working with her, I think, have picked up on this. First, find the problem, the right that needs to be wrong. And she aimed at plenty of those. Secondly, figure out a paradigm. And obviously we have a problem that hasn't worked, resolution, so let's think about it in new ways. She had schema after schema, methodology after methodology of thinking about things in a new light. Third, it's not good enough to develop a paradigm. Let's measure it. It needs to be reproducible. Some of you know that she developed all series of measures. Some, you know, the ACGs that we work with, and CHIP and PCAT, they're used in dozens and dozens of countries, millions and millions. ACGs, 80 million at last count. Patients are impacted every day. All because of her desire to measure and move forward. Well, measurement isn't enough, okay? Let's understand why there's the problem and try to rectify it. And then lastly, raise holy hell to get the problem resolved. So she wasn't just a scientist, she was an activist, and I think you all know that. But she wasn't just an activist either. She was an Institute of Medicine globally respected scientist. So a little bit, and I'm cognizant of the time because we have a lot of my colleagues have wonderful things to say, and again, we'll have an open mic at the end, but just real rapidly. First, she started out pediatric, clinical, and community-based research practice, not research. When she first came here, she started at the Midwood High School in Brooklyn, right, Tony? And as I understand, the second most famous person from Midwood High School is Woody Allen, correct? Or maybe Barbara was the second most famous, I'm not sure. And then she went to Swarthmore, where she fell in love and married Tony and got an honors degree as well. And then she went back to Brooklyn for medical school. And then she came to Harriet Lane Clinic. One baby already, right, Tony, at that time? Yeah. But with 3 more to come, as Ellen mentioned. Of course, that was just such a huge part of her that we all knew about, although I'm focusing on the professional. But then she came to the Harriet Lane Clinic to get her pediatric residency. But for the first 3 years, I wasn't there at that time, but I'm convinced, being the medical director of the clinic, Tina, maybe you'll tell us a little bit about this, medical director of the clinic, and then doing outreach, I think that cemented her view of the world. As we all know, as wonderful as Johns Hopkins is in its own way as a tertiary care medical center, the care and the people in this community is not so wonderful. It's, if it were a separate country, we'd be, what, 70th down the list in terms of measurement. So I'm convinced that that drove her for everything that followed, the first 3 clinical years. Then, from her clinical background, she moved into pediatrics health services research. I'm sure she was a great pediatrician, but she wanted to have a greater impact. From pediatric health services research to primary care health services research, arguably the best known primary care health services researcher in the world, not just here at Johns Hopkins. I think that's a fair statement. Most of you agree? Yeah, a lot of nods. And certainly 27 Lifetime Achievement Awards, or 27 awards of which half are Lifetime Achievement. I think her favorite, and Chris, who put the slides together, rolled it. One was she got an honorary membership of the Royal College of General Practice in Britain. I think she's very proud of that. She was neither a general practitioner, not royal, and not British. And I don't think they give a lot of those out, spending a lot of time in the UK, you know, so I think that's in part because her JAMA article put the UK at the top of the list of primary care, so I believe they felt it was appropriate to give her that award. But then after her primary care research, we talked about the development tools, and then she rapidly moved into policy and politics in primary care. A lot of very influential articles with Liu, James Masinko, who couldn't be here. He's in Brazil at the moment, and that's a huge piece of her work. And then, as I noted, as Ellen noted, rather, as I mentioned before, although throughout her career her sensitivity to social determinants, she founded, along with Liu, and then passing over the leadership to Efrat Shadmi, you'll hear from both of them, this new international journal on health equity. I think that she viewed as absolutely critically important. When she was here, I think she accomplished so much. Her 23-page CV, and I'm not going to read the whole thing to you, but as Ellen mentioned, she was here at the start in the 1960s and 70s. I hope we hear from that, Vincente. It was the first or second department in the country of health services research, healthcare policy, the integration of medicine, epidemiology, economics, sociology, and she and a variety of others were really absolutely key to that, so well beyond the primary care movement. She published 350 articles, some of which are absolutely famous, right at the top of the lists of publications. You know, some of them include just to give a flavor, effectiveness of pediatric care, the relationship between process and outcome. Pediatricians weren't talking like that in 1970. And I think she is, and Chris will comment on that, and Tina, again, arguably the best-known pediatric health services researcher at that time. She did a lot of work with a lot of colleagues here in some of our early HMOs, defining what is primary care. You couldn't do it on the basis of GPs or FPs, family doctors, GPs, general practitioners, because we didn't have so many around here. And with Don Steinwachs and at the Columbia Health Plan and East Baltimore Medical Plan really helped define what is primary care. Many of you know she wrote the book, I don't think that's an exaggeration, the book on primary care. So, Tony's putting up his hands. It's actually 2 editions, 4 languages, and I'm pleased I heard that Tony and Norma Lee are bringing out a 3rd edition in the public domain. Quite a legacy. It is definitely, I have never read any article in the US or in most other countries that talk about health, primary care policy that don't reference that one first. What else? I'm very anxious to share the global. I think just a little, I could give a lot of stories, but that's really the job of the people that come after me. I mean, one of my favorite is her traveling. I got to travel with her a little bit. You know, like most people, 1 country a month is okay for me. She would do that a day, no, usually 2 a week, 3 a week. And so people would ask all the time, where in the world is, you know, Barbara San Diego? Remember the Carmen San Diego? And then she got a BlackBerry. Somebody gave her the global BlackBerry. So it was, then we could reach her. But, you know, she'd have her knitting needles, her BlackBerry, which I understand she lost a few times, but usually she was connected. She insisted on reviewing manuscripts on 2 sides because she fit everything in her underseater. So, you know, there I am with my suit bag. I mean, I travel light too, but not an underseater. And she'd run through the airports, and then, you know, once we get to the hotel, some of you have stories too, it was, you know, taking hikes around the city, and then you probably saw some pictures. If there's someplace nice, we take a hike there. And this is a lady, who had energy, half of people half her age. So it was just phenomenal. And everybody will always remark about that. I think, her legacy will be profound. I think it's often said that people that spend their life focusing on what will come after, have really truly led a great life. And I can't think of anybody of any of my colleagues that will leave, and have left as great a legacy as her. As I mentioned, we're going to be holding a symposium in May of next year, and one of the goals is to try to continue that legacy. We'll announce that, and I hope some of you can come. So, I think in closing, another saying that is probably appropriate is time. If you want to leave a footprint, and Barbara's footprint was great, you better not tiptoe. And nobody would ever say Barbara tiptoed. She was pretty adamant about how she felt about things, and that's why she accomplished a lot. Although I know she was a fantastic grandma, so she probably tiptoed when the kids were napping. But I think the impact, which we'll hear about from the people that will come after me, and we're going to also hear about it, I think, for the next 20, 30, 40 years, from the 150 people that she trained directly, from the instruments and tools that are now in use in 20, 30 countries, from the opinions that she changed, from the approaches that she changed. And I just think that is something that Tony and family and all of us should really just celebrate. So again, thank you all for coming, and we will, I guess, turn it back to you, Ellen, and we look forward to talking more during the open mic session. So thank you all.
Okay, now we have the privilege of hearing from several of Barbara's closest colleagues, friends, and mentees. And I'm going to introduce them all at once and then have them come up as they're ordered in your program. First, we'll hear from Chris Forrest. Chris is a professor of pediatrics at the University of Pennsylvania and the Children's Hospital of Philadelphia. Chris was a very close colleague of Barbara's for over 15 years, and Barbara was his doctoral advisor. He's also a former member of the faculty here at the School of Public Health. Ann Riley will follow Chris. Ann is a professor in population, family, and reproductive health, and Ann is also a very close colleague of Barbara's for over 20 years. Leu Shi will then follow, and Leu is a professor in the Department of Health Policy and Management, and as Jonathan just mentioned, is co-director of the Johns Hopkins Primary Care Center. Leu co-directed the center with Barbara, and they were colleagues for over 15 years. He is also the co-editor of the International Journal for Equity and Health that Barbara founded. Vicente Navarro. I think, where's Vicente? I think you got the cake for I was going to say the oldest, but I'll say the longest colleague of Barbara. Knew her the longest, was a very close colleague of Barbara's for over 35 years, and is also a professor in the department here at Bloomberg. Rob Reed from the Group Health Research Institute was one of Barbara's doctoral students, and was that kind of cemented a relationship, and they've been close colleagues for some 12 years following that. We're particularly pleased to have Efrat Shadmi join us today, all the way from Israel. Efrat is on the Faculty of Social Welfare and Health Sciences at University of Haifa. She received her PhD here at Health Policy and Management in 2005, and she also has collaborated very closely with Barbara since that time. And Barbara handpicked Efrat to be the co-editor of the Journal on Health and Equity that Barbara did found. And then finally, Tina Cheng. Tina is Chief of General Pediatrics and Adolescent Medicine here at Johns Hopkins. She's also a professor of pediatrics. Tina and Barbara also collaborated for many years here at the Department of Pediatrics in the School of Public Health on pediatric and primary care research and advocacy. So we're going to start with Chris Forrest.
Thanks, Ellen. So as I was assembling the slideshow that we were looking at as we walked in, I was struck, going through the photos, by how alive and healthy Barbara appeared in all those pictures. She lived her life fully, didn't she? She was just an amazing woman. Jonathan pointed out just how much energy she had. She also enjoyed to challenge herself. I remember when she was in her 60s telling me that she was learning Spanish so that she could go give lectures in Spain in Spanish. And then she lived life with passion. That's the word I think that comes to mind when I remember Barbara and many of my colleagues. It's passion for her husband, passion for her family, passion for young scientists and her mentees, and passion for sure for her scientific causes. I like to think that science advances in the same way that great buildings are constructed. Most scientists deem themselves fortunate if they can add just a brick to a wall. Some trailblazers add a wall. Barbara actually built several structures in the grand edifice of science. Her legacy includes not only her family, but also a prodigious and inspiring body of work that will continue to shape and influence research, practice, and policy on children's health, primary care, health equity, and health services for many years to come. All academic researchers are affected by key relationships. I was affected very much by my relationship with Barbara. For her, Kerr White was a guiding influence. She advanced his vision of primary care as the foundation of health systems by using these new tools of health services research to scientifically demonstrate the mechanisms by which primary care can promote health for whole populations. 2004, I actually was fortunate to interview Kerr White about Barbara. No one, he said, has done more to advance primary care than Barbara Starfield. When I asked him why he thought this, he briefly replied, her science. It was her science that gave her the platform for advocacy, for health equity and primary care-oriented systems across the globe. Barbara saw the world of science so clearly that at times she would inject a few words into a conversation that would completely turn the discussion into a new direction. There was a meeting that I held on this new field of child health services research, and we began discussing how we should organize the field. Lots of discussion on focusing care on kids with asthma, behavioral health problems, sickle cell anemia, and cancer. We should study those health problems and understand the delivery system, then transform the delivery system for children with those problems. For most of the conversation, Barbara sat in the end of the table knitting quietly. After a few hours, she spoke up very passionately and quietly and reminded us that children need to be seen as whole persons. They're not diseases. That the problem with current research is that it focuses on conditions. We should be much more interested in promoting the health potential, a concept that she articulated in a New England Journal of Medicine article, the health potential of children, and ensure the capability of every child to live a wide range of possible lives. That's equity. Her pithy comments totally changed the theme of the meeting. Barbara was an incredibly organized woman. She was a huge advocate of ensuring that all academic work served at least two purposes, one of the best pieces of advice she gave me as a mentee. For example, she taught a course on primary care that lasted 8 weeks. It had 2 sessions per week, 16 sessions. She developed materials for those courses. Ultimately, those materials turned into writings for her students. Her students edited those, and then she turned it into 16 chapters that became a highly influential book on primary care. Barbara's most powerful legacy, though, after all, is all of us who've been affected by her writings, her teaching, and her friendship. She laid the foundation for the scientific structures that those of us in child health, primary care, and health services work within. Honoring her legacy in many respects means working together on the great challenges she so passionately pursued throughout her career. As we strive together to elucidate new strategies and policies that help to mitigate and ultimately eliminate health disparities and improve population outcomes, we will be knitting together, alongside Barbara, new structures in the grand edifice of science. Thanks.
I'm Ann Riley. I'm very honored today to be able to take the opportunity to say how important Barbara was to me, as she has been undoubtedly to all of you. She was a dear friend, esteemed colleague, and a very demanding and challenging mentor. For that, I thank her every day. As I thought about what Barbara would want me to say or want me to focus on, other than how important she was to me personally, it was pretty clear that the theme should be much as what we've heard already. That the review of her life's work, of the passion that she brought to so much of the efforts in the health systems across the world to improve health, that those kinds of things were what we should remember and talk about. She had a few major lessons, and I think we're all trying to summarize them. I guess we'll be doing that for many years in our own minds. Clearly, one was work with the best. Another, identify the important ideas. And once you figure it out, once you think you're on to something, stick with it. Believe in yourself. Don't give it up. Then translate it, measure it, turn it into something concrete, something that people can use to make change. So a few brief slides, I think, bring this home, that, very early in her career, she understood that it was very important that social status, economic status, and social position really had big influences on health. This was a time when we were seeing this science come out of the UK. It certainly wasn't very well represented in the States. It informed her thinking, and she continued in this field, subsequently contributing to it for over 25 years. Note that her more recent focus that's been mentioned on equity in health is not so much equity in healthcare, but as you see in 2007 and many subsequent articles actually, equity in health. They're very different. I first met Barbara when she, right after she had published this paper, and I thought it was quite innovative, but it was in fact preceded by several other papers. And like so much of her work, it started with a pretty simple question. Basically, are health problems random occurrences in the population, or do they cluster together in individuals? By the time she wrote the 1985 paper, she knew the answer. And she thought that focusing on children was particularly important because at that time, particularly, we thought kids were healthy, right? This was an elegant summary of the fact that over a 6-year period, many more children than would be expected by chance were healthy, had very low healthcare use and just positive healthcare use, and many more children than would be expected by chance were unhealthy, were sick. And many of those children, most of them, the sick ones that used a lot of healthcare, didn't have a chronic disease. They were just less healthy, she thought. But in those days, we really didn't have a way to measure health, certainly not children's health. We were just getting started in measuring health, even in adults. But Barbara, of course, had already started on this journey. Back in 1974, she had published this paper on her own, The Measurement of Outcome. And basically, this became a model of health. It actually directed the work that we did together, along with Marilyn Bergner and Peg Ensminger and Ann Skinner. It directed our work in the development of the child health and illness profile. And it was interesting at that time. I was just getting to know Barbara and didn't realize how amazing she was in those days. I was pretty impressed, but not as much as I am now. And there was really, I would have thought, we would look around for different models. There weren't many models of health. Still today, there aren't too many models of health. But that was really not a question. we were using Barbara's model. That was it. She developed it, had to be right. And so we did, and it really did work. These are some of the first papers that came out in the development of the adolescent and childship, so that now there is a set of questionnaires that can allow children themselves to respond about their health from the ages of 6 through 18 or even older, as it turns out. And the work has been taken on by colleagues around the world, particularly our colleagues in Spain and Barcelona, which were very important to her. These instruments have been translated at least into 22 different languages, and several advances, including some that Chris and I and colleagues have moved forward, are built on these instruments. So we can, as Barbara would say, there are many other issues and things that we need to be focused on. These early papers on the effects of family on health and healthcare use, the focus on the populations, and certainly focus on equity. As she would say and has written, we cannot afford to rest on our laurels for the good work that we've done. New advances will give us new opportunities, new ways of solving the old problems of inequity and suffering. Barbara continues to provide the light and energy for all that we need to continue this work. I'm grateful to have been so lucky to work with Barbara over many years and to be guided by her still today. Thank you.
Good afternoon. I'm Lei Yuxi. I first met Barbara Starfield in 1996 when I came to Hopkins for a faculty job interview. Barbara served as a member of the search team. We chatted for over 2 hours about our common research interest, primary care, and how we might collaborate to advance research in this area. Her excitement was evident and her enthusiasm contagious. Over the next 15 years, we worked together on numerous fronts. We served as co-directors for the Primary Care Policy Center and published studies on primary care and community health centers. Together, we have co-authored about 30 journal articles, and we have individually written over 100 papers over those 15 years. We also organized journal clubs, conferences, and training programs. We worked to improve the primary care assessment tools, which are now used not only in the US, but also in over 30 different countries. Barbara was the founding editor of the International Journal for Equity, and I have served as a co-editor. We have also co-taught the proposal writing course for our PhD students and have co-mentored several PhD students together. I last talked with Barbara the week she passed away. Just like our first meeting in 1996, we talked about primary care and how to further advance the research in this area, how to further refine the primary care assessment tools, and how to streamline the management of the International Journal for Equity. Just like our first meeting in 1996, Barbara was as excited as ever, and all the more optimistic about the prospect of primary care. I believe many of us would agree that Barbara Starfield devoted her life to advancing primary care. Over the years, Barbara was more than a great colleague and a mentor. She was a great friend. Barbara was always accessible. We met regularly to discuss research projects. Barbara responded to emails instantly, no matter where she traveled, day or night. What's remarkable about her is that she did this not only to friends and colleagues, but also to students and even strangers who asked questions about her work. How many of us can do this like Barbara did? Barbara was also very interpersonal. During our contact, we did not just talk about work. We talked about our families, our hobbies, and shared our life problems and stresses. She was a great mentor, always challenging you to the next level. Yet, in times of need, always extending her warm hands. Barbara was extremely comprehensive. Those familiar with her work style would agree that she always wanted to get to the bottom of it, constantly challenging herself and those around her. She was critical, not only of others' work, but also of her own. She often played the devil's advocate about her research, trying to anticipate what an opponent or critic would say. Barbara was a great coordinator. With so many things on her plate, editor, speaker, researcher, author, mentor, teacher, reviewer, she was always well organized. She never procrastinated. Barbara never forgot anything. She carried a notepad and jotted down all the details. She would then implement those. We would discuss something and could not reach an agreement. You would think she would have forgotten about it. Lo and behold, she would come back and raise that issue again. She was always on top of things. She was a master planner. She also involved others. Barbara Starfield practiced what she preached. She spent her lifetime promoting primary care, specifically its unique characteristics of accessibility, continuity, comprehensiveness, and coordination. She also exhibited those traits with her own example. In perhaps her last publication before her death, appropriately in the International Journal of Equity, Dr. Starfield conveyed the theme she has promoted uncompromisingly throughout her career and life: primary care as a way to improve population health and reduce disparities. Barbara wrote, "Primary care must inevitably assume increasing importance in health systems because it is far superior in dealing with multi-morbidity over time." As colleagues and friends, we are all deeply saddened by Barbara's sudden departure. As we mourn the loss of Barbara, we are also determined to continue on her legacy, her career aspiration of seeing primary care ascending status in this country, and more importantly, that our population health truly improve and health disparities significantly reduced. Thank you.
To speak about my good friend Barbara for only 5 minutes is quite a challenge for me. She and I knew each other for half a century, 50 years. We both arrived at Hopkins in the middle of the 60s, a very hectic period in the history of our country, United States. I arrived in 1965, and I believe she arrived the same year. We both were invited by Carl White, the founder of our department, called at the time Medical Care and Hospitals. Carl had enormous influence on Barbara and on me as well. A Canadian liberal in the Bertrand Russell tradition, Carl encouraged us to question the conventional wisdom of the medical care establishment of the United States, profoundly conservative at that time. We're speaking about the 60s. And Barbara did so and continued during her own life. She always combined a deeply felt commitment to changing our society, to improve the health of people. And she did it with strong rigor and scholarship that make her very effective. The combination of commitment to social change and scholarship was the main trademark of her life. Her major focus at the time was primary care, and she was very successful in raising some of the most important issues in the area of work. She soon became a leading scholar in that field. A point not much known in her biography is that she was also the founder of the International Journal of Health Services. Carl White had asked both of us to create a journal that could raise the often unwelcome questions that needed to be raised in the health policy circles in our country. In that sense, the journal was very much a creature of the 60s. Barbara was extremely helpful in those early times and instrumental in the establishment of the journal, International Journal of Services. Barbara herself was a product of the 60s, as I was. And she never abandoned her commitment to changing the United States, a country that she profoundly loved and she was very frustrated with. As a matter of fact, she was more influential in changing policy and legislation abroad than not in our own country. For example, in Spain, she was instrumental in establishing the Primary Health Care Act that benefited 40 million Spaniards. She was very supportive, back in the department, of the integration of Sam Shapiro. Sam, Carl White, and her were the key agents of change in the school and in the establishment of our department. Sam and Barbara were very close friends. And from the very beginning, they shaped the nature of our department. She also became a very strong supporter of the fusion of our department and the Department of Public Health Administration, a major development in the history of our department. Her community orientation made her very receptive to the idea of joining medical care and public health. She was the perfect type to join this area of knowledge and this area of commitments, one dealing with individuals clinical and the other one with communities. As she used to say, our commitment should always be with the denominator, that you could see her epidemiological background. By denominator, she meant, of course, the population. She continuously said that our commitment is to the population denominator and not the numerator, the institutions. This is how the health policy section, and later on the health and policy sections, came to be part of the organization of our department. Barbara was instrumental in creating those dimensions in our department, health policy. She also, at the beginning, strongly supported health service research, and she was also a very active member of that part as well. So the combination of health service research and health policy, the two major souls of our department, had Barbara at the beginning and also to the end. She was in these areas, another thing that is worth stressing is that she was also heavily involved in health inequalities, a comment that had been made by my other colleagues, and also what later on became the social determinants of health. In all these areas, she was always ahead of her time. She told me once, Vincent, to be radical is to be thinking 10 years ahead. And that is what she did all her life. She was always thinking ahead, 10 years ahead. And today, many things that were considered to be radical at the time are part of the conventional wisdom. She was a radical, and I'm sure she will now be very sympathetic towards the Occupy Wall Street movement, because she loved the country. It is people like Barbara who improve the lives of millions of people, including our own, and enrich us in the process. She was a remarkable human being and a superb colleague and a friend.
Hello, my name is Rob Reed, and I was Barbara's doctoral student back in the mid-1990s. And it's really an honor and a privilege for me to talk today at Hopkins as one of her countless students, and Jonathan, thank you for counting them, and fellows and researchers that she's taught worldwide over more than 40 years. I can honestly say that Barbara changed the course of my professional career, and she profoundly altered the way I think about science and about healthcare and how I interact now with my own students and own mentees in my current job. I met Barbara in 1992 when, as a Canadian family physician, much in Kerr White's history, came to Hopkins to do a Master's of Public Health, and I took her course in primary care. And although I'd been a practicing primary care physician for many years then, with some bravado, it wasn't until I took Barbara's course that I really did realize the key functions of my chosen profession and the value that it brings to the health and healthcare of people worldwide. She gave me the theory and the science base behind my profession, and that was a true gift that has remained my true north until this day. And even though it's been close to 20 years since I took that course from Barbara, it is hardly a day that goes by that I don't take what she taught me and put it into my day-to-day practice. When I moved on to become her doctoral student, Barbara demanded of many things, and clear thinking was one of them. She was rather intolerant of any sloppy ideas that I would bring to the table. And she insisted for the ideas that I brought to be meaningful, they needed to also be measurable so that they could be studied. And she didn't budge here. And I am so thankful because it really taught me the necessity for rigor of ideas, rigor of measurement, and the rigor of study design that can move the science and healthcare delivery forward. After leaving Hopkins and moving on to a career as an independent researcher, Barbara continued to be my most important mentor. She was always so generous with her time to advise me on my career decisions and to open the doors for me to move things ahead. She took the time to come to and keynote presentations that I was organizing and provided almost instantaneous feedback for anything that I was writing and needing feedback on. She gently challenged me when she thought I was getting a little off track and wrong, and she was, generally right. In life, you only have a few opportunities to ride on the shoulders of giants. And Barbara has been a giant in our field, and I was really lucky enough that she took me and countless others along with her, mentoring us along the way. Barbara and Tony were so kind and thoughtful and generous to me, and I'm so ever grateful. And I will really very much miss her dearly. Kerr White said in 1994 that Barbara, above all, had provided the major intellectual and scientific underpinnings about the vital role a primary care must play in any rational, balanced, and effective and compassionate healthcare system. And Dr. White was entirely right. I know that many of my colleagues in the room today, Barbara's thinking is deeply ingrained into our own. And we will continue to embody her work, and it will live on. I am currently the medical director of one of the medical directors of a large healthcare system in Washington State that looks after hundreds of thousands of people in that area of the country. And Barbara used to talk to me and lament about the sorry state of primary care in this country and how the rest of the world was surpassing it in large effect. There is clearly a fire in my belly and a fire in the belly of our organization in Seattle to really put primary care in its rightful spot and really produce the health benefits that Americans so rightly deserve and reduce the disparities for those that are socially disadvantaged. Barbara's ideas and her research and her science base really do ground the changes that we are making and making in many places across this country. And I'm really working hard to make sure I'm putting her words into action for the benefit of Americans. Thank you.
My name is Efrat Chadming, and I want to thank you for the kind words. I was very privileged to have Barbara asked me to take over her role as editor of the International Journal for Equity in Health and to try to make the transition as she wanted it to be, with the right platform and the right continuation for the journal. And I'm very lucky, together with Leo Shi, to try to continue her work in this aspect. But I really wanted to talk about something else, maybe a small example that many others, I think, have addressed, talked about, or mentioned. And this is her role as a mentor. For me, her mentorship meant many things, but probably two main aspects. One was that she planted a seed, and the other that she then encouraged it to grow and develop. About 10 years ago, as a student at the Department of Health Policy and Management, I approached Barbara, and she was kind enough to meet with me to discuss some ideas I had for my dissertation. And during that meeting, Barbara asked me to think about the following idea, that there are no chronic or acute illnesses, that this classification that is commonly used, and as a nurse in my background, I was very much used to thinking about the meaning of a chronic condition and its clinical applications. But to her, during that meeting, she said that this common classification of diseases to acute or chronic is not necessarily useful or accurate. Now, at the time, and for quite many years after that, I had no clue what to do with this. I had no idea how to take the next step. Jonathan was mentioned, this is a paradigm shift, and now it needs to be measured and translated into a research question. And I was really perplexed, but it resonated and stayed there. Quite a few years later, when I was starting to do some work together with Barbara and Jonathan and many other colleagues on chronic conditions and diseases using real data with real people, I managed, of course, together with my colleagues, to show a part of what this means, what this non-classification into chronic and acute might mean. How might this translate into something that can be measured and be associated with outcomes? But to me, this, of course, was, as a junior researcher, only one study, one aspect. Others have done the work, and I was very much insecure. And this is when the encouragement came in. The feedback Barbara provided, reviewing and re-reviewing in detail every draft, her encouragement to continue, her encouraging words made me very enthusiastic to continue and to really drive the point through. If there are two things that I hope to be able to follow her giant steps, is to be able to be a mentor like she was, and in others to plant the seed and then to encourage its growth. Thank you.
Barbara Starfield had a tremendous impact on the field of pediatrics and pediatric primary care specifically. She always challenged us to think broadly and was an advocate for primary care and public health. I had the honor of interviewing her for the Academic Pediatric Association's Oral History Project and wanted to relate my memories of her through her own words. First, many of us knew her for her leadership in health services research and putting science into general pediatrics. Health services research was a new field at the time, as was general pediatrics, and it was informed by her clinical work. She was considered the godmother of pediatric primary care research and the godmother of pediatric health services research.
Bob Cook allowed me to spend the entire third year in the outpatient department, where I did lots of different projects. It was a wonderful experience for me. And he actually went out on the limb and certified me as eligible for the boards for that. And when I finished that, then he suggested I go to the School of Public Health, and then he invited me back into the Department of Pediatrics. And we did, I think, the first health services research project ever done at the Johns Hopkins Hospital, and that was evaluating the impact of public health nursing incorporated in the outpatient department. And we chose the management of enuresis to study the impact of nursing, and the nurses would make home visits. And so that's how I got to be the bedwetting doctor, which I had the reputation of for several years. And we wrote a little book on how to manage bedwetting. But that launched me on my career in health services research.
I remember her as a model of someone who combined clinical medicine and public health and really challenged us to think of systems and to think not just medically, but psychosocially and socially.
Carl White came to the School of Public Health. He was recruited, and he was a very unusual person because he thought broader than either public health or clinical medicine. He was a clinical medicine, he was an internist. But he'd been to the UK, and he'd seen what an organized health system could do. So he came here, I went to see him, he gave me some things to read, and I was absolutely hooked immediately. And within a week, I transferred my appointment from pediatrics to what he called medical care in hospitals. That was the department's name. And that's how come I've been mainly in the School of Public Health, although I continued my interest in clinical work even to this day. And I think of myself as someone who tries to put clinical medicine and public health together.
Third, she was a leader in forming the discipline of general academic pediatrics and was an early president of the Ambulatory Pediatric Association, now the Academic Pediatric Association, the professional association of academic general pediatricians in primary care. Her APA presidential address in 1981 was entitled Poverty, Health, and Medical Care, and she received APA's highest award, Lifetime Achievement Award.
I function now mostly in the world of primary care, and that's not only with children. That means children exist in a context, they exist in a family context, and in a community context. But when you focus only on how are children doing or what can we do for children, we forget that what we can do for children is very dependent on what's done for their parents and grandparents. So I would like to see the APA's strategic mission moving out of the box, moving towards more conjoint work with the other primary care specialties, becoming less disease-oriented and more illness and health-oriented.
Fourth, we all know her as a staunch advocate for primary care and generalism. Her books are the primary care Bibles, and she was consistent in her message.
Get out of the shell, relate to the other primary care societies, support primary care. Because if there's any hope of improving the health statistics in this country, adults as well as children, it's going to be through a reorganization of the health system with primary care as a strong core.
Finally, I'll always remember her as someone who spoke her mind and challenged us to do more, to think broader, to work together. She was truly an inspiration. Do you think children are better off today than they were 50 years ago?
No. No, because times have changed. So you can only evaluate how well children are doing in the context of the times. And we have different challenges nowadays. So children are doing just as poorly now as they did then. Maybe not biomedically. Although the truth of it is, our health statistics, infant mortality, we're about 27th in the world. Under 5 mortality is about 20th in the world. We still got a long way to go.
We do have a long way to go, though she's pointed us in the right direction, and the field and those coming after her will always be indebted to her. If you want to hear some more of her words, you can find it on the Academic Pediatric Association's homepage.
Thank you very much, Tina. That was fantastic. I hadn't seen that before. It's wonderful. I'd now like to ask Tony if he'd like to say a few words.
Why don't we let people who want to... Yeah, it was going to be...
Okay. All right. That would be fine.
It was going to be after.
Okay. Great.
Thank you, everybody. That was very, very meaningful and special, and we, as you can see, we could probably go on for a few hours. But there's also a lot of other experiences that people had with Barbara, such a multifaceted person that touched pretty much everybody in the room. We have about 20 minutes for sort of an open mic, Quaker style, as I say, remembrances. 3 people asked ahead of time, and we'll let them go first. And that's Karen, Kinder, Charlene Black, and Sydney Wolf. But after those 3, we have 2, so I'd like them to go first. But after that, we have as much time as people would like to speak, up to about 20 minutes. So I would recommend that people limit themselves to 1 or 2 minutes. I know that's tough. So Karen, Would you like, there's a microphone there, and a that's probably more efficient than coming here. What do you think? People can come here. Is that what you're pointing, Don? Yeah. So if people can come up, Karen first, then Charlene, then Sydney, and then as many people it was like as time will allow. And I will give people a sign just to be fair. No, you're just first, so that goes to everybody.
I'm Dr. Karen Kinder, a graduate of Health Policy Management, also faculty. I'm also the Executive Director of ACG International, able to promote and support the ACG system, which Barbara created 30 years ago, worldwide. Looking around this room, you wouldn't know it, but her influence, as Professor Navarro indicated, was felt much more outside the U.S. than inside. She never hesitated to express her disgust with the U.S. system. I had the pleasure of traveling with Barbara and accompanying her over the last few years on many of her trips worldwide, and I was always amazed at the warmth and receptiveness of the international audience to her ideas. They not only listened to them, but they actually implemented them and acted upon them. And in contexts where she wasn't present, her name or references to her work were always mentioned. Her perspective on multimorbidity and looking at patterns of morbidity as opposed to individual diseases framed the basis of the ACG system and paved the way for the success internationally. We're now present in 18 different countries, and our work is very indebted to her leading the way. Thank you.
Hi, I'm Charlene Black. I've come in from Vancouver, British Columbia, to be here to honor Barbara's memory. I just wanted to say how much of an influence Barbara has been. I think Rob Reid's words summarize for me a lot of the feeling and inspiration we had as her students. And the additional thing I wanted to add, Rob and I were talking in the cab on the way over here, and reflecting on how Barbara had this incredible presence, this ability not only to think of whole persons in the healthcare system, but whole persons in her mentees. She was really able to understand this person in front of her and to offer us very individual and very specific support in the ways that we needed it. So I think that one of the remarkable things was the way she could really, really understand us and contribute to our growth in very different ways. I think we both experienced her in different ways, and we were surprised at that, and yet recognized that this was part of her incredible legacy, was how much of a contribution she could make based on our individual needs. She was also, I would say, Dr. Shi described her as more than accessible. She was more than accessible. I was probably one of those students who kind of escaped. I went back to Canada and she lost track of me a little bit, but she tracked me down. She came after me on numerous occasions and really came to find me. So that my last meeting with her was, I'll never forget her arriving. She'd been in British Columbia doing work on primary care, staying at one of her new mentees' places. She often did that. She often stayed with us in our homes and really got to know us. She wasn't staying with me at this time, but she invited me out to dinner with another colleague. But she wanted to take a break because this person she was staying with was actually making her work a little hard. So she was out on a long bike trip. She showed up on my front door taking a break from a bicycle trip. So I'll never forget that. It was such a special visit. She always tracked me down, and I'm so grateful. Her presence will be with me forever. So thank you.
I'm Sid Wolf with the Health Research Group of Public Citizen. As I was listening to people, the thought, which is not a typical thought that comes up for me, was of an afterlife. And whereas there are differences amongst people in a religious sense, I think that everyone in this room would agree, and this symposium is a testament to that. Barbara's afterlife is the impact she's had on everyone here, and I'd just like to tell a little bit about the impact on the work I've done on me and on one of my 4 daughters. Barbara and Tony are people I've met maybe close to 40 years ago, and when I left NIH 40 years ago this year to start doing the work I'm doing, Barbara and Tony were incredibly supportive. The word supportive really comes to the fore in everyone's talk. I was doing something without the protection, so to speak, of an academic medical center. I was doing things that other people thought there was something wrong with them, particularly the drug industry and the device industry. But I got all sorts of support from both of them. And indeed, part of the support resulted in my joining as an adjunct the faculty of the Health Policy and Management Department here, which made it possible for us to have residents such as Rob Reed, who was a resident with us 12 years ago, I believe, 14 years ago, do their preventive medicine residency, part of it with us. We've had about 24 residents, and I am happy to have been at least on the faculty to the extent that I can do these things. But much of the work we do has to do with prescription drugs and medical devices and diagnostic tests, and Barbara and Tony have always been extremely supportive in that. And I noticed, ironically for me, that one of the last publications was one in the Journal of American Medical Association this year, where Barbara and Tony were raising serious questions about some problems at the Food and Drug Administration in terms of their failing to follow up on some drugs that they approved. I just want to close in saying the impact was not just on me. Barbara is alive because her impact is still there, but also one of my 4 daughters. I have 4 daughters, Hannah, Leah, Rachel, and Sarah. And the second one, Leah, although she was pre-med, had 2 parents who were physicians and was not clear that she wanted to go to medical school. She worked at the Office of Technology Assessment, which most of you know was around. I think a couple people here who actually worked there. And she did that for about 6 years after finishing undergraduate school at Cornell. And one day she said, I've decided I want to go to medical school. And I said, why? She said, because in terms of having an impact on healthcare, one of the people that I know the best that has influenced me is Barbara Starfield. And so Leah, who's now been at Bayview for I think 12 years. She did a residency there, a chief residency, and was actually running the primary care internal medicine residency program. It really owes a lot to Barbara. So I just want to close and say she is alive in the best kind of way, and I think we all know that.
Margarita, and then Karen. Yes, I guess come down here. So.
Okay, Barbara's favorite color was purple. These are all going to be disjointed thoughts, but that's one of the things that I remember a lot. And I have a lot of connections to Barbara through several people here, Anne and Rob and Chris and Jonathan and others as well. And as I was driving over here, I was trying to think of a word to describe Barbara, and there have been 1,000 of them mentioned, but I thought that one of the things that she did is she did give freely of her ideas, and she didn't commercialize her instruments like other scientists have done and other universities have done. So in that way, I thought of her being really a truly humanitarian and not looking at using science for her own benefit. So I thought that was very important. And another disjointed thought, this whole movement with medical homes. When I heard that, I was like, this is just primary care. What's this whole deal about the medical homes? I mean, Barbara's been talking about this for a very long time. And I think the last time I saw her, I honestly was probably at a conference, but where it was a more long type of exchange was at her home. I was writing something or trying to write something on a measurement framework for certain aspects of primary care in Latin America. And she had a whole set of articles already for me, and she always loved to be challenged. I mean, she challenged me, but she also was not, of course, I guess that's pretty stupid to say, but anyways, not afraid to be challenged intellectually, and I'd love to have that exchange with her. And so I think that's about it. I'm still searching after all the time that and all the conversations I've had with her.
I'm Karen Davis. It's wonderful to be here and to hear all of these portraits of the Barbara that we all knew and cared deeply for. And I wanted to say a little bit about my association with her over 3 decades and how much she inspired me for being a pioneering researcher, a gifted teacher, and a loyal colleague. I had the privilege of being the chairman of Health Policy and Management here at Hopkins from 1983 to 1992 and worked with Barbara closely over that time. I think as we've heard here, everybody understands that Barbara was the world's foremost leader in primary care research. And for me, she was the one who demonstrated that the nations with the best primary care systems also had the best health outcomes and the lowest cost. I was in Washington today releasing the Commonwealth Fund's latest scorecard on health system performance, and that theme of countries that really have strong primary care really excel on what we really want from our healthcare system. Despite those decades of research, I think it's really only now that Barbara's work is really coming to fruition, at least in the U.S. It's reflected in the provisions of the Affordable Care Act that President Obama signed in 2010. It's reflected in recent recommendations of our Medicare Payment Advisory Commission that would favor primary care. It's reflected by the patient-centered medical home movement, and it was really Barbara who saw, before anyone else in this country, what a key ingredient it was in a high-performing healthcare system. As you've heard today, Barbara was also a talented and beloved teacher, and she really cared passionately about students. And many of you and many others came here specifically to learn from her, and she devoted herself to preparing them to make significant contributions to research and improving healthcare practice. You've heard, she was always very generous with her time. She was always very accessible. I thought of myself as getting here early. She was always here before me. But she was always there for anyone who was going through a difficult time. But I thought I might share one story. You can see what a great mentor she was and what a great advisor she was. But I was chairman at a time when the decision was made to have students rate courses. And I was a little bit ambivalent about this because when you write an anonymous poison pen letter, it can be vicious. And some faculty's confidence was a bit undermined by those student reviews of their courses. But Barbara took it as an opportunity to be an even better teacher. And so what she did, she said, I've written out all of my lectures for this course, and you, as the students, are going to teach this course. And she assigned students to teach every session, and they could take her material and decide how to best teach students about that. It became the most popular course on campus. But the other thing that I wanted to stress is just what a loyal colleague she was. She was dedicated to Hopkins as an institution and the people close to her. She spent her entire career here, and to me that says a lot. Most people kind of spread themselves around in different locations, and she really helped build the reputation and the reality of Hopkins as a world-class school. And she did that, as she did so many other things, selflessly, without regard to credit or other reward. And so your presence here today is a testament to the incredible impact Barbara had on so many people who are now scattered around the U.S. and indeed around the world. And like all of you, I will miss her dearly, but I'm so grateful for having had the honor of knowing her and calling her my friend. Thank you.
Did you want to make we have time for a few more short comments. Thank you. Please introduce yourself before you speak.
My name is Jack Geiger, and I got to know Barbara really well for the first time in 1983, 1984, when we were both on sabbatical years at the Center for Advanced Study in the Behavioral Sciences at Palo Alto at Stanford. And we had met before, but we really had time to be together in a particular way. We were drawn together by two things. I'd been associated from the beginning with community health centers and their commitment to primary care for individuals and responsibility for the health of a population. And Barbara, and then later Dr. Shi, had already started publishing the whole series of seminal papers analyzing and defending the kind of work that community health centers did. But the second, perhaps more powerful bond was the fact that both Barbara and I proved to be, by temperament, profoundly unsuited for the think tank environment, which was dedicated to isolation, contemplation, that kind of work, in pursuit of which there were no phones in the study corrals, and it was before the arrival of personal computers. There was this long curved bank of study corrals that had kind of the appearance of a motel for intellectuals, and right in the middle, outside of one of the banks, there was a phone. So Barbara and I hung out at the phone for a good part of that year, connecting ourselves back to the world and talking to people who were doing research or projects that we cared about, and having time to talk with each other. This was a family enterprise because every morning while we were at the phone, Tony and my wife Nicole Schuff got in a car and went to Berkeley to do a degree in public health, which in fact was the beginning of a whole new career for Nicole. Barbara and I, then after she had started organizing the International Society for Equity in Health, were able to fulfill that sense of travel over isolation, meeting in Havana in South Africa, an old stamping ground of mine, and South America. And finally, most recently, I was aware that I was getting older, and so I knew that Barbara must be getting older, but here came this endless stream of papers and communication on a variety of listservs. And our last contact, not long before her death, was when she skewered on one of the listservs, an opponent to primary care. And I joined in, and then we kind of gave each other an email high five. And it was typical of the kind of spirit and dynamism and courage that characterized this whole relationship. And like everyone else here, I'm grateful that I had that chance. Thank you.
Thank you for sharing. We have three last people to make a quick comment. Thank you. Please introduce yourselves.
Hello, everyone. I'm grateful for being here, too. I was first debating whether I should speak or not because all of you are her scientific colleagues in the medical community. Well, I sort of knew very little of this because I'm a lifelong friend of hers. We met 50 years ago, actually in about 4 days. One of Tony and Barb's friends, one of their sons and my son will be turning 50. So we have known each other since there was a kindergarten connection. And this was we even almost bought your home, but it was being built as we were searching for a home. And we thought, well, we better wait till there's a home already built, not to have any problems. Well, Barbara and Tony and me and my husband have gotten together through the years, and it's remarkable how she's made time with all the peripatetic existence to which you've alluded and to which always amazed me, the energy, the enthusiasm, the fabulous ability to get from here to there with her
just a single carry bag. And I even asked her for some tips on packing, which she helped me with. Because, how do you do it? She slept over at her house one time. She always would make a point, even though when they had moved west, to come back, and very often, well, one time at least, she stayed over at our home. Our children, as I've alluded to, are very close in age. So all during those elementary school years, we knew each other on and off, and the kids connected. And one of your daughters is an education specialist, and came to my daughter, who's also a mentor out at Menlo Park, Stanford, and they live in Menlo Park, Deborah and her husband, and my daughter and her husband. So we've actually been out there to visit and swim in the pool of their home, which I have now a sad memory about. The best thing I like to say is you mentioned her afterlife, and that was very telling. When they moved from Baltimore, they have 4 kids and a home in the Adirondacks, and they moved here and there and kept up with the family always closely. When they left their home, Barbara gave all her knitting supplies to me. So that's the legacy of the afterlife. I'm actually one of the presidents sort of a sit-and-knit group, and I've talked about it, and we actually are meeting tomorrow. I'm going to show them all her stash. So that was another wonderful connection. I just will miss her very much, and she's just a symbol to me and of my life, the whole passage of life, and having children and being connected, and a professional life, even though my profession was different. And my hat's off to Phoebe and to Tony and to all of you. Thank you.
Thank you for sharing. 2 last people.
Thank you very much. My name is Hernan Montenegro, and I work at the Pan American Health Organization, WHO, in Washington, D.C., and I'm here on behalf of our director, Mita Roses, and some colleagues that drove from Washington, D.C. We have about 5 other colleagues that came for this special occasion, and we want to thank the opportunity to be here and say a few words about Barbara. I have to say that Barbara supported us in what we call the process of renewing primary health care in the region, and that it did have actually an impact at the global level. There was a Well Health Report 2008 even that was dedicated to primary health care. So this is this international connection that everybody has been stressing up. She was an incredible person in all the ways that have been said here, and I won't repeat them, but to me it resonates a lot that she wanted change, her commitment, her passion to fighting inequities in health. She saw how primary care was the right strategy, and so on. She was generous, she was extremely brave, and the only thing I wanted to add to all what has been said is that this international projection is not only from the students who met her here, who studied here and then went abroad, but I saw her abroad in different conferences, and I can say I saw her personally in Brasilia, Brazil, giving a speech on primary health care. I saw her in Doha, Qatar. I saw her in last May, in Bridgetown, Barbados, speaking again on her passion on how to address population health challenges, equity, and so on, and her strong commitment to primary health care. So I think she was an extremely brave person, and I think that basically her work, wherever she went and she spoke, she just commanded presence and she influenced so much. So the only thing I wanted to say on behalf of our organization is that we value so much the possibility of working with her, the opportunity to recognize her work, and that her work will, be as important in the U.S. as worldwide, and she will influence and she has inspired a whole new generation of public health persons that will keep fighting for for her big mission that she fought for all her life. Better health for everybody, equity, and the strong commitment to primary care as the foundation of an equitable and efficient and effective health system. Thank you.
Thank you, and thank you for your colleagues also for coming up from D.C. Last open mic remembrance, and then I think Tony would make some comments after that.
Good afternoon. Good afternoon. I probably have my name is Cecilia Snowden, and I was registered as a PhD student graduating in 2000. But my comments are about the little things. And whether things are little or big, it's dependent on the view of the person. Dr. Barbara Starfield, and when I came to Hopkins, I came after maybe a 36-and-a-half-year career at NIH, and I was going to embark on this great PhD endeavor. But I met Dr. Susan Horn, many of you remember, and Dr. Barbara Starfield the same day. And coming to Hopkins, it was a new thing to me because you could call her Barbara. But in most environments, you call them by their last names. And I was coming to Hopkins where you call many of the professors by their first names. But Dr. Starfield was my coach through the written 3-day part of the comprehensive exam. Many of you know what I'm talking about. She was my 24-hour, 3-day coach. And call her I did at all hours, and she was right there on the phone. She nursed me through that 3-day exam, and which paved the way for me to continue, because obviously if you don't finish that part, you're X'd out. So Dr. Rowley, y'all know, you know me, right? But anyway, after all these years of being in public health with a master's degree, I came to Hopkins to get that great PhD. And it's through Barbara's 3-day, 24 hours, common spirit, keep at it, you can do it, that helped me to get here. And her greatest legacy to me is to mentor other students, and particularly minority students along this road. Thank you.
Tony, would you like to make some comments?
Well, as I listened to you all talk, I was sort of thinking about things that might not have been said about Barbara. And I thought I found some. But then Vicente mentioned Carr White, who had not been mentioned up to that point. And it's probably not a surprise because the first people didn't really know Carr White. And then usually being upstaged by Barbara, Barbara mentioned Bob Cook. And these two giants, really, and I guess it was Newton who said that he walked on the shoulders of giants, and I think that we have to really give credit. And Barbara certainly did to Bob Cook, who brought us both here as interns at Harriet Lane. And then, as you heard from Barbara herself, was instrumental, which very few other department chairmen would even look across the street or knew there was a school of public health or school of hygiene at the time. But Bob Cook did, and I think he had great foresight. And then, as I say, Barbara upstaged me because I was thinking the one thing that none of you really knew, and I don't know if it's Elizabeth Sharp here? Okay. She was a nurse and got a PhD, and then it was Barbara herself who took away the line that I thought would add some levity to this when you heard Barbara call herself the bedwetting doctor. And this was actually her first research with Liz Sharp, looking at, I guess they call them community health visitors, and the role they could play in supplementing medical care. There are a few other things, and some mention has been made to that. on various websites that have been put up again and again, several times, people say, you know, I'd email Barbara and I'd get a message that she would be out of touch for 10 days or a week or whatever it was, and then 10 minutes later I'd get a full reply back from her. So this was very good for her colleagues, but before 2005, before the BlackBerry era, let me tell you that when she got home, it was very difficult because whatever she might have thought about me, what had to come first was answering all those emails that had accumulated that she hadn't been able to answer in those days because she was away and didn't have any direct means of doing so. And I think I was instrumental when she got the Baxter Award, and I forget exactly the name of the society that gave it to her. They called me up and said, you know, there's a gift that comes with this plaque or whatever. And instantaneously I said, a BlackBerry. So, but what is it like to be married to Barbara Starfield? And that's something that only I can answer her. And I'm going to speak very briefly about Barbara yesterday, today, and tomorrow. And there are two poems involved in this presentation. I'm going to get help with one of them. One of them lingers on the past, the other looks ahead. They may seem contradictory, but they both provided me a great deal of solace. Yesterday, the first stanza of a song by John Dowland stunned me with its evocation of my feelings after the fatal instant when my love for Barbara became unrequited. I heard it while driving through a beautiful Adirondack Valley on an August afternoon, 2 months after she died. And I'm not going to sing this. Come again, sweet love doth now invite the graces that refrain to do me do delight. To see, to hear, to touch, to kiss, to die with thee again in sweetest sympathy. Today, this is not a poem. I think often of Barbara, the wonderful times we had together, the joy of helping 4 wonderful children grow. Of doting on grandchildren, of traveling together and visiting esteemed friends, of just talking. To see, to hear, to touch, to kiss, not yet to die, my life goes on, and with few exceptions, continues the pattern established with Barbara. She was as wise in personal living as in her professional life. Soon after she died, I anticipated reverting to my old slovenly ways. I haven't, and it puzzles me. Is it because she had inculcated her habits so firmly? You've heard that she can inculcate her views quite firmly. Is it because is that her ways were better? And they've gotten older and still relatively healthy. Maybe they were. Finally, is it my way of showing her my love? Sometimes I almost believe she is watching. And many of you may have that feeling too in your professional lives. I want to tell her how the oleanders have grown after last winter's killing frost in New Mexico, or that one or more of our grandchildren has done something remarkable, as grandchildren often do. Barbara set our pattern of daily exercise, swimming one day, walking the next, sometimes both in one day. She always made time for these things. After she was diagnosed with coronary artery disease, she was determined to build up her collateral circulation and would walk rings around me, which she never did before. I adopted her regimen and continue with it to this day. She did not die of heart disease. Under her influence, I hope I have become a better person. She thought more about others, and I have attempted to emulate her. She was the one that remembered birthdays So far, I haven't forgotten any, although I sometimes have failed to mail the cards on time. I wanted to phone her last week to find out where she put the gift wrap. And after searching high and low, I finally found it. Barbara did not succeed in correcting all of my faults, but her death has made me more aware of them and eager to rectify. Tomorrow, I am neither a reader nor a writer of poetry, but some of the most supportive condolences have come from poems sent by good friends. This sonnet was sent by Mary Helen Snyder, who's here, and I'm going to ask her to read it to conclude what I want to say. So it's a poem by Pablo Neruda.
If I Die, by Pablo Neruda. If I die, survive me with such sheer force that it awakens the furies of the pallid and the cold. From east to east, lift your indelible eyes. From sun to sun, dream through your singing voice. I don't want your laughter or your steps to waver. I don't want my heritage of joy to die. Do not call up my person. I am absent. Live in my absence, as in a house. Absence is a house so vast that inside you will pass through its walls and hang pictures on the air. Absence is a house so transparent that I, lifeless, will see you living, and if you suffer, my love, I will die again.
Don Steinwalks will make a few closing remarks.
It was suggested I make some concluding remarks. I really don't have the words that are adequate to do that. You've heard from friends, colleagues, students, family, and they have told you a story. And in many ways, I think of Barbara as epitomizing what I learned to be the kind of culture in public health, both among the faculty and the students, that people want to make a difference. And what makes Barbara exceptional was that she found a way to make a difference much more broadly than most of us feel, probably that we can do ourselves. We talked about her research. There was a paradigm shift in how we thought about primary care. There was a shift in the capacity to measure primary care. And measurement gives power. It gives data and information that just didn't exist before. She was an advocate, but an advocate that used science as the basis of advocacy. And she had a passion, but she translated that passion in carrying the science and the understanding to all of us. And she left a very big footprint. There were several discussions about that. And that footprint is a legacy that she gave to those of us who are her colleagues, to those of us who she mentored, to her students, to people she reached out to her family and friends. And the professional dimension is only one of her many strong dimensions, as we've also heard. So I'll ask you to take a moment of silence and to think a little bit about both what we've learned today and what we ourselves individually have learned from Barbara. Well, I know we're all going to be thinking about her for many years to come, and she's given us something to carry forward. into the future that can make a real difference. There is a reception following this. The reception is in Finestone Hall. Some of you will know where it is. For those of you who don't, you can either follow others, or if you go back out the way you came in and turn left, you have to go probably about 100 feet, and you'll see Finestone Hall on your left. So look forward to having you join us there, a chance to talk among friends and meet new friends who all share something in common, Barbara Starfield. Thank you.